EH&S orientation training. Emergency response. Kempton Park facility. The NCP Emergency Control Centre is responsible for the overall coordination and handling of responses to all incidents on the Kempton Park site and off-site in conjunction with the emergency team. In the event of an injury, gas release, explosion, fire, chemical spillage, or a bomb threat, immediately report the incident to the NCP Emergency Control Centre and to your supervisor. When reporting any incident, always remember to clearly state your name, where the incident is, what type of incident, and any injuries. While on site, the Emergency Control Centre will be responsible for activating the site emergency plan. Emergency numbers: *7119 NCP Emergency Control Centre, *7176 EH&S Manager, *7122 Medical Centre. How to respond to emergencies. Types of alarms and what to do. Emergency under control. A continuous, long, 2-minute ring. This means the emergency is controllable by the emergency team and you should remain at your workplace. Evacuation alarm. An intermittent, on, off, 2-minute ring. This means you should stop work, follow emergency shutdown procedure. If applicable, take note of the direction of the windsock. Follow your floor marshal and evacuate to the assembly point. Your assembly point marshal will conduct an attendance check. All clear alarm. A continuous 30-second ring. This means that you may return to your workplace. Alarm test, Friday, 12 o'clock midday, for 30 seconds. Responding to a medical emergency. Due to the nature of our business and operations, we have established which incidents may occur within our business. However, they are not limited to these. Medical emergency. Common steps to be followed in the event of a medical emergency by the first responder are as follows. Regional personnel. Call your supervisor or manager. Kempton Park site. Call *7119. Clearly state your name, the type of emergency, and the location. Note: ensure that the emergency controller fully understands your request and the location of the emergency. Notify the EH&S manager of the incident by dialing *7176. Call the first aider or emergency response unit in your department to administer temporary medical aid. Different types of emergencies, all operations. Chemical exposure of any nature. Remove contaminated clothing and ensure that the affected area is rinsed with water for at least 15 minutes. Seek medical attention if required. Gas inhalation. After phoning the Emergency Control Centre, remove the employee from the area where hazardous gas is present. Do not make the employee walk any further than what is a safe distance, as oxygen needs to be preserved. Sit the employee down and ensure that they are comfortable and that they stay calm. Continuously ensure them that they will be fine. Ensure that there are no obstructions in the airway and remove any clothing around the airway area. Cuts and bruises. Apply pressure to the wound to stop bleeding and wait for the emergency team or emergency responder. Unconsciousness. Call the emergency services or emergency response team for your area. Report the incident to your EH&S manager. Do not move the employee. Ensure that the airway is not obstructed and stay with them until the emergency team arrives. slips, trips, and falls. Call the emergency response team or emergency services for your area. Report the incident to your EH&S manager. As far as reasonably practical, do not move the employee unless they are under direct threat of any other workplace hazard. Stay with the employee until the emergency team arrives. Vehicle accidents. Being in a vehicle accident can be devastating. Always try to remain calm. If you are able to, phone the emergency services, Netcare 911, tell them where you are and report any serious injuries that you or your passengers have incurred. Once the situation is under control and you and your passengers are not in direct threat of serious harm, contact your supervisor and EH&S manager. Responding to a chlorine gas release inside a building. The steps to be followed in the event of a chlorine gas release indoors are as follows. Call star 7119. Clearly state your name, the type of emergency, and the location. Note: ensure that the emergency controller fully understands your request and the location of the emergency. Notify the EH&S manager by dialing star 7176. Stay indoors, close all windows and doors, and switch off all air conditioners. Use a wet cloth to seal the underneath of doors. Follow all the instructions of the floor marshal. The EH&S manager will liaise with the floor marshal in your area. Important note: always keep your half-mask escape respirator with you. Safe rooms in your area. Plant, control room. Maintenance, mechanical and electrical, tea room. Engineering store, laboratory and plant office, plant boardroom. Warehouse and small packs. Tea room. Warehouse, NCP 5, tar jet and acid fill. Warehouse office lobby. Head office. Boardroom. Responding to a chlorine gas release outside a building. The steps to be followed in the event of a chlorine gas release outside are as follows. Call star 7119. Clearly state your name, the type of emergency, and the location. Note: ensure that the emergency controller fully understands your request and the location of the emergency. Notify the EH&S manager by dialing star 7176. Put on your respiratory protection, half-mask escape respirator, or full-face respirator. If possible, try to isolate the source of the leak. Operational personnel. Check the direction of the closest windsock and move out of the area in the opposite direction. Follow your floor marshal to the appropriate assembly point. The EH&S manager will liaise with the floor marshal or marshals in your area. Important note: always keep your half-mask escape respirator with you. Responding to a fire. The steps to be followed in the event of a fire are as follows. Regional personnel. Call your supervisor or manager. Kempton Park site. Call star 7119. Clearly state your name, the type of emergency, and location. Note: ensure that the emergency controller fully understands your request and the location of the emergency. Notify the EH&S manager by dialing star 7176. Instruct all the employees in the area to move away, upwind of the fire. If possible, try to extinguish the fire by means of a fire extinguisher or a water bucket in the area. Signage of correct fire extinguishers to be used for different fires must be posted at fire extinguishers. The EH&S manager will liaise with the floor marshal or marshals in your area. Extinguishing aids for different fires. Why is it important to report any incident immediately? As the safety and well-being of our employees are
HTH.
priority, we need to ensure that employees get the correct treatment at the correct time. All injuries on duty, IODs, need to be reported as such to ensure that employees are not accountable for any cost incurred during medical treatment for injuries related to work. If you are a manager or supervisor and an incident is reported to you, ensure that you liaise with the EH&S manager or designee for any support with regards to advice on medical treatment and emergency response. General duties of a floor marshal. Know the designated assembly points and emergency exits. Know the locality of the windsocks. Know all the emergency telephone numbers. Floor marshals are the middle point between the emergency team leaders and emergency services. In case of emergency, keep all telephone lines open. Always be informed of sick and impeded persons in their responsible area. Floor marshals must appoint a reliable alternative to act in their absence. All unaccounted persons must be reported to the emergency team leaders. Check and maintain emergency evacuation kits. Assembly point marshals' duties. Ensure that all people at the assembly points have an escape respirator. Ensure an updated roll call list of all employees for that specific area is up to date. Do a head count and report to the floor marshal. Keep an eye on the windsock for change of wind direction, and if necessary, know where to move personnel to a safer area. Ensure that all personnel remain at the assembly point until further notice is given, or the all clear alarm is sounded. Ensure that no smoking is allowed at any assembly point. Ensure that some type of communication link is always available to the emergency team leaders.